Healthcare delivery in Oyo State has been on a steady path of renewal, from the groundwork laid in Omituntun 1.0 to the progress of Omituntun 2.0. The goal has remained constant: access, quality, and continuity of care. This is how Oyo State continues to expand the reach of healthcare, one facility, one worker, and one patient at a time. At the start of Omituntun 2.0, the government pledged to complete renovations in outstanding primary healthcare centers, upgrade secondary facilities, and strengthen emergency and preventive care systems statewide. Primary healthcare renewal. Under the Impact Project, 106 primary healthcare centers have been revitalized. Many of them are among the 93 facilities identified earlier for urgent repair. 264 primary healthcare centers have already received new equipment, and plans for 51 more renovations are underway, aiming for at least one functional PHC in every ward.
As I'm speaking now, we have about 212 primary healthcare centers fully completed, and we have all the other ones at various stages of renovation. And now, under the Impact, we have a project called Impact: Immunization plus Malaria, Accelerating Progress and Transforming Services. The project also, it's from the Federal Ministry of Health, and we also have what we call Basic Healthcare Provision Fund. So these two projects, they focus on primary healthcare centers. Another primary healthcare centers, we have another 106 primary healthcare facilities that are supposed to be refertilized, and the work is ongoing at various local government areas. Part of the criteria chosen for those 106 were service centers that can render level 2 services, level 2 kind of care, so that if you go there with basic emergency obstetric and newborn care, they'll be able to render it and now cascade it, if they can manage any of the cases, cascade it to our secondary healthcare facilities. So we have another 106 that is ongoing at the moment. Then apart from this 106, we also have another 66. Even though all of them are interwoven, the criteria for choosing for choosing them differs. Some of them because of the volume of people that they serve, some of them because of the number of staff that they have. So to be able to say, okay, they have skilled birth attendants in any of those facilities, those were the criteria used to choose them. And also, let me talk about equipment also for primary healthcare centers. In terms of equipment, the basic equipment that we need to survive in primary healthcare centers are also made available. Let me take, for example, you know that some of our primary healthcare centers are in rural areas. Some of them are going to be provided with solar so that they can run their services. Because of the attrition in laboratory, most of these primary care centers, they do not have a well-equipped laboratory. But we realize that in some of these facilities, what we need is what we call the point-of-care test kits. So they are going to be provided with some of these test kits, like malaria test kits, strips for random or fasting blood sugars, strips for maybe typhoid fever, strips to check them for their PCV. Instead of waiting for electricity to come and maybe are waiting for solar, they can get strips that can quickly check the PCV, the packed cell volume, and be able to measure the level of blood that they have. Then apart from that, some are, because of those rural areas, because of the issue of electricity as well, there are some of these equipment that can serve in rural areas, but they have to operate them manually. Some of them are being improvised or being provided also in all some of our primary healthcare centers, so that the basic equipment that they need in primary healthcare services are being supplied.
Health workers and manpower. Over 3,000 medical personnel have been recruited and are being posted to newly equipped facilities. This ensures that infrastructure improvements translate into better service delivery.
Under the human resources in primary healthcare centers as well, recently the governor approved that we recruit 3,000 primary healthcare workers, and they have recruited them. It's across all board. Amongst them, we have community health extension workers, community health officers, medical officers, nurses, medical officers, nurses, pharmacists, pharmacy technician, in all the areas related to health.
Upgrading secondary healthcare. 6 general hospitals from Ring Road to Hussein are earmarked for upgrade under the new healthcare initiative. Procurement processes are in motion, laying the groundwork for improved diagnostics, maternity, and emergency care at the secondary level.
In our secondary healthcare facilities, we have not achieved more in our secondary healthcare facilities. And why? Because when we came on board 2 years ago, part of the things that we needed to do was this French loan. And the French loan was to take care of our secondary healthcare facilities. And as I'm speaking now, we have not even accessed that French loan. And because of that, it seems as if our secondary healthcare facilities are being neglected. Some families are coming on board to help us with our secondary healthcare facilities. I could cite the examples of a family member that helped with General Hospital Igbora. They help in some of the renovations in General Hospital Igbora. There's another family at General Hospital Igboho that did some work there. Some family also rose up to help us with the borehole at General Hospital Isheyin. So families have been coming on. They want to immortalize their family, the names of their family, and they are coming on board to say that, okay, let's render this help, let's render this.
Maternal and child health gains.
Part of the promises made was to reduce our maternal mortalities. And according to multiple indicator cluster survey for the year 2024, I'm happy to tell you that the maternal mortality rate reduced. Actually, they are using 512, which is for the whole Nigeria. But for Oyo State picked out, it's reduced to about 244 per 100,000 live births. So we are happy for that. And also for our neonatal mortality rate. The neonatal mortality rate, that one is according to Nigeria Demographic Health Survey, NDHS. That one reduced from 30 neonatal mortality rate to 17 per 1,000 live births. Then our infant mortality rate reduced from 41 to 18 by 1,000 live births. And also our under 5 mortality rate reduced from 64 to 24 per 1,000 live births. So we are winning in those areas. And why? Because the effort is being made to make sure that our skilled birth attendants, the hospital services that we have skilled healthcare workforce at work. And also part of the things that we also help in reducing maternal mortality, particularly for our children, is to be able to bring on board training for the healthcare workers on breastfeeding, on how to take care of the younger ones, particularly when they are being born. And I'm happy to tell you that throughout last year, we have series of training, capacity building for people in the health sector, both at primary healthcare, both at secondary healthcare, even at tertiary facilities. We had trainings on maternal, infant, youngborn, and adolescent nutrition, what we call MySIN. And other than MySIN, is under the project that we call ARIN, Accelerated Nutrition Results in Nigeria. It's rounding up now, but the training capacity building throughout last year, we have one training or the other for all our healthcare workforce.
Health insurance and financing. More residents are protected through the Oyo State Health Insurance Scheme.
Recently, we flagged off the issue of public primary schools being enrolled, being empaneled into insurance. So they enrolled public primary schools pupils so that they have access to go to primary healthcare centers that is closer to their school. So in case you have any child at such schools running down with maybe diarrhea, with a fever, they can quickly take them to the primary healthcare center that is closer to their school. And I think they are bringing on board about 100,000 pupils to start with. And not only that, you know that we have pensioners on board, we have vulnerable people, we have elderly ones on board as well under the health insurance.
Non-communicable diseases and public health initiatives. Project 10 million, Know Your Number, Control Your Number, has expanded awareness on hypertension and diabetes. Early detection is now a statewide effort. Seasonal malaria chemo prevention has reduced under 5 malaria cases by 85%. 3 local governments have been declared free of onchocerciasis and lymphatic filariasis. Oyo State was recognized nationally for its neglected tropical disease coordination efforts in 2024.
One of the promises made was to reduce non-communicable diseases. And we have certain non-communicable diseases that if you see our elderly ones, you know that it's common in them. And what are these non-communicable diseases? Hypertension and diabetes. If you bring like 10 elderly people now, amidst them, you see like 5 of them having hypertension and diabetes. You see like the 7 having hypertension alone, maybe another 8 having diabetes alone. That's how it's common. So what we do was to launch what we call Project 10 Million. Know your numbers, control your numbers. We launched it so that anybody coming to the hospitals, we take their data. If they are hypertensive, we cancel them, give them drugs, tell them what to do. You know your number today. I'm coming today, my blood pressure is 150/100. I receive health education, I get my drugs. Some of them are enrolled under insurance so that they can have access to be able to get their drugs. And by so doing, they know their numbers for that particular event. So by the time they are coming for another encounter at the hospital, it's 150/100 before. Now they are coming maybe like 130/80. We know that we are winning. So it's one of the measures that we put in place to be able to curtail or to reduce the non-communicable disease. Another remarkable achievement is the reduction in under 5 malaria cases. We have what we call seasonal malaria chemo prevention. Under this seasonal malaria chemo prevention, some children are targeted from 3 months to 59 months. And we have 6 local governments where this is being cascaded. They call it season at the peak of rainy season. They start giving them anti-malaria prophylaxis. They call it SPAC, sulfadoxine, pyrimethamine, and amodiaquine. So they give to all these children. And why? Because we know that in those areas chosen, malaria is predominant there. So when we give them as a form of chemo prevention, so our malaria cases is coming down. Malaria cases, both the complicated and the uncomplicated malaria cases coming down. So we have that achievement, remarkable reduction in under 5 malaria cases under this seasonal malaria chemo prevention by 85%. For neglected tropical disease elimination, that's why we talk of these swollen legs, elephantiasis, soil transmitted hemorrhages, onchocerciasis. Now, the reduction, the campaign, the elimination is about 78%. Last year, about 30 local governments are brought on board to participate in this mass administration of medicine and also for the neglected tropical disease. This year alone, some people that have elephantiasis, some people that have hydro-C from neglected tropical disease, some of them are operated on, particularly those that have hydro-C from neglected tropical disease. And those that have elephantiasis, they do some of disease modification for them, give them drugs, how to take care of the wounds. And last year, the State Coordinator for Neglected Tropical Disease won an award for the best state coordinator in the year 2024. Then one of the things that have been done in secondary healthcare facility is also the Drug and Health Commodity Management Agency. It's all about to be able to curtail unavailability of drugs and also to curtail the issue of I get here, I'm buying expensive drugs, you are getting here, you are getting cheaper drugs, so that it will be uniform across the state. Also last year, we launched our essential medicine list so that when you open the book, I don't have it there, you have all the essential medicine that we use in the states.
Disease control and preventive health. Tuberculosis diagnosis rates have improved by 89%, and 93% of people living with HIV now have suppressed viral loads.
In terms of infectious disease in the states, one of the infectious diseases that is common is tuberculosis. And now, effort has been intensified to making sure that we have reduced number of people that we see with tuberculosis. So we have early diagnosis and reduction in tuberculosis transmission. Now we have about 89%. We are able to pick them on time and be able to diagnose the disease on time and start them on treatment. And part of the achievement that we have is through the addition of what we call gene experts. The gene expert machine, we have additional gene expert machine to be able to detect this disease. They bring their sputum and they're able to test. So it's for testing. The gene expert machine. We have the TB lamp. Also, it's a machine, and all of them are procured for TB testing. And as I'm speaking to you, we have what we call 6 portable digital X-ray machines. You know, when you get to the facilities and you want to have a chest X-ray done, for the chest X-ray, you will wait for electricity, you will wait for X-ray technician to be able to test. But we have this portable machine that you can carry around. So with the use of AI, artificial intelligence, so this portable machine can be set up and we can use it to take the X-ray of people, and with that we are making presumptive diagnosis of tuberculosis, which is helping up anybody that we do that for, and we are able to make presumptive diagnosis of TB. We now send them to the facility to go and do sputum test.
Infrastructure and innovation. Oyo State now operates PSA oxygen plants at Jericho and State Hospital Oyo, improving oxygen availability by 70%. Plans for 50 additional ambulances and an electronic health record system are in progress to enhance response and data management.
In terms of infrastructure, again, in secondary healthcare facilities, last year, His Excellency helped us in commissioning our pressure swing absorption oxygen plant at Jericho Specialist Hospital. And as I'm talking to you now, it's being replicated in 2 other facilities across the state. There's one at State Hospital Oyo, there's one at General Hospital Ogbomoso.
Addressing human resource gaps. To curb brain drain, 333 health workers were recruited by the hospital's management board. Intern quarters for pharmacy, nursing, physiotherapy, and lab science have also been expanded to keep young professionals within the system.
Then in terms of human resource, last year again, His Excellency approved that we recruit 333 secondary healthcare workers, the nurses, the pharmacists, physiotherapists, pharmacy technologies across board. But nurses are many amidst this recruitment. So they recruited and they have been distributed also to all our secondary healthcare facilities.
Regulation and public safety. The task force on anti-quackery is digitalizing private health facility records to curb illegal practice. Another task force monitors food outlets and water sources to ensure public health standards are maintained.
So one of the major achievements last year is our task force. When we came aboard, we had issues about anti-quackery. People opened facilities, they are not qualified. You see some of them primary school, even secondary school leaver, helping to open the hospitals. They are the one there that you see as doctors or as nurse. So what we did was to make sure that we strengthen the anti-quackery task force. So it's cut across all the MDAs that we have people, physiotherapy, dentistry, all the health family. So they are embedded in the anti-quackery task force. Police is there. We have police amidst us. We have someone from the Ministry of Justice. Even we have someone from the Ministry of Information. They are in the anti-quackery task force. What do? At times people will lodge complaints to say that in this healthcare facility, a lot of people are dying. Why are they dying? What is the rationale? Or maybe mismanagement of patients. So we get there. When we go there, we want to know the health personnel there, are they licensed to practice for that particular year? If they are not licensed, that means they are quacks for that particular year. Because as a doctor, you need to do annual practicing license. As nurses, you need to do practicing license. Their own is every 3 years. But for doctors, it's every year. And likewise, all the other allied health families. So by the time we get there, as a doctor, we want to see your annual practicing license. If you don't renew your practicing license for that year, you are a quack. Another thing that we did last year is our directories of food and water and laboratory services. We have reports of people using all sorts of things to prepare food that people eat. You go to some eatery, you see houseflies on the food that they are giving to the people. What we did is just to strengthen the task force on food safety, and that one is somebody. A lot of people have been found culpable that they have to go, and we found out that a lot of people don't even register their outlets. So they are coming back now to register their outlets. And what we want to do, we want to digitalize all these private facilities and want to bring on board the eateries also, the food and safety, so that, but the digitalization is 40% complete now. We've started, but we have not completed. Hopefully by this year, we are going to complete it. It's about 40%. We have few things that we need to do. So that is part of the achievement. And anytime you go to our private facility, just look at the board, you see a seal. The seal will tell you whether they have been registered and they have been clear for that particular year. If you don't seal it, most likely they are quacks or they have not done the needful.
Community health and free medical missions. The Omituntun Free Medical Mission continues to provide screenings, minor surgeries and consultations at no cost, especially for the elderly, women and children in rural areas.
Free Medical Mission is to bring all the people in Oyo State, in all the 33 local government areas in Oyo State, bring them out, see their health needs. Some of them, they have medical needs, some have surgical needs. What are these surgical needs that people have? A lot of people are going about with groin swelling. What later layman we call it groin swelling, but we call it hernias. So we do hernia surgery in free medical mission, or Omituntun free medical mission. Hernia surgery. People that have breast lump, they do lumpectomy for them. People that have hydrocele, they do hydrocelectomy for them. And it's moving around all the 33 local government areas in Oyo State. And we also put in this Omituntun free medical mission, know your number, control your numbers. The people that we have been seeing, those that can afford treatment, we encourage them to go on. But those that cannot, we encourage them to register under health insurance. So it's all encompassing. Medical consultations, not just medical consultations alone, breast examinations for our women, and they have been seeing people with suspicious lump. Some that are simple, they do lumpectomy for them. Some, they refer them for another level of care so that we get to know what exactly is going on. Then we are doing cervical screenings, so to be able to detect anybody that has suspicious cervical cancer screening and be able to place them. You know, cervical cancer is preventable and it's also curable, but if we pick it early. So we are doing cervical cancer screening, and a lot of our women are benefiting from that Omituntun free medical mission. And not that alone, we are doing what we call rehabilitation. Physiotherapists are there. They are doing some massaging for our people. They are giving some walking aids for people that have difficulty in walking. So they are doing it for them. We have our dental people on field also. A lot of tooth extraction, a lot of scaling and polishing, a lot of filling. Now, last year also, we developed and disseminate our scorecard. Our scorecard and fact sheet. The scorecard is for us to be able to monitor ourselves in how well we are doing in terms of some indices, some key areas. And what are these key areas? Key birth attendants in our hospitals, antenatal care usage, malaria, how many people are assessing malaria, how many people are assessing rapid diagnostic testing for malaria, how many people are assessing bringing their children for immunization, Penta 3 vaccination, antenatal care visit at first visit, at third visit, how many of these pregnant women are taking intermittent prevention of malaria in pregnancy. So these are scorecard. We have seen ourselves. We want to follow up on this so that we know that the local government that is not doing well, we can flag them. So we did that one, and it's a form of achievement for us.
Promise kept. From renovated facilities and trained personnel to improved maternal health and expanded insurance coverage, Oyo State has sustained the momentum of its first term and continued to strengthen the health system.
There are two major things. One side, health is wealth. And tó bá ní okun tó ní àlàáfíà, gbogbo ló ní. And the second one ni pé tí ebi bá kúrò nínú ìṣẹ́. So those two things, your government will continue to focus on a healthy population and also tackling poverty in Oyo State.
Oyo State, strengthening healthcare access for today and building a healthier tomorrow.